Welcome back. Thank you very much for staying with us here on The Full View on SABC News. Well, Cuba has agreed to help South Africa as the country fights the spread of the coronavirus. More than 200 Cuban doctors will arrive in the country tomorrow. The island nation boasts a strong healthcare system. Many students from Africa study medicine there. In previous cases of the crisis, Cuban doctors were first to arrive in Africa to help with the Ebola crisis. Well, to discuss this, we are now joined on the line by SABC News foreign editor Sophie Mokoena. Very good evening to you, Sophie. Thanks very much for joining us.
Good evening, Flo.
As a start, of course, as I've just mentioned in the story, it's not the first time that Cuban doctors arrive in Africa, well, in South Africa as well, in order to help us in terms of fighting some kind of a disease. How successful have they been, for example, when they came to Africa to come and help with Ebola?
Well, indeed, the relations between Cuba and the continent dates back during struggle years. We know that the relationship has been strengthened at government level. And in South Africa in particular, you'd recall that former leader of Cuba, or the Cuban leader Fidel Castro, and our former president Nelson Mandela had agreed that they will allow certain students in South Africa to go to Cuba to study medicine there. And that relationship continued. When the Ebola crisis was with us on the continent some years ago, it is Cuba that stepped in, and many other countries did follow thereafter. They really did help the continent to deal with the Ebola crisis. That is why now the only area that is still battling with this Ebola crisis is the DRC. The World Health Organization had indicated that the country was about to really be declared a Ebola-free country, but unfortunately 3 weeks ago they detected 3 cases, and that was a problem for World Health Organization. Therefore, they are not strangers to the continent, and also in terms of relation and availing themselves to come and help. Cuba has done it before, is doing it again.
Well, Sophie, we do know that the Cuban doctors are not just coming to South Africa. They have been going to other countries as well to try and help with COVID-19. Is that help essential in terms of the fact that, can we look at some of the other countries where they have been going and saying, yeah, they made some kind of a mark there? Are they really, as they arrive in South Africa, going to make a difference and help us with those scary numbers that, we're fast approaching?
One thing many people always talk about is the level of training or medical training in Cuba, particularly their primary health care. They have a huge talent, but also experience and expertise to deal with health matters. We have 1,200 Cuban medical personnel around the world currently in 22 countries where they are assisting. Perhaps one can take an example of Italy in particular, where we saw lots and lots of people dying in that country. And the arrival of the Cuban doctors did assist, because at that time when they arrived, it was at a time where health personnel in that country were also affected by this virus, and many of them had died. And therefore, them coming in, they did assist. We beginning to see the country now stabilizing, but a lot still needs to be done. I think in this case, the same is going to apply wherever they will go. They will be able to share their experiences, and also they'll be able to assist because they are bringing different skills. It's not just your physicians that are coming. Many other people who will be in, or many other people will be part of that group, will be having different skills. And therefore, I think it will be a good thing for them to share information and experience with our own medical team here in South Africa, in different parts of South Africa, particularly in provinces where you have high numbers.
Now, one might ask the question, Sophie, about, regarding their skills. Wouldn't their skills be better utilized in their own country? I mean, I'm looking at the figures, and these are the latest that I've seen so far coming out of Cuba. I mean, it's not as if Cuba is in the clear. They're sitting at 1,285 coronavirus cases, and from the last that I checked, it was 49 deaths. Surely their skills are needed in their very own country. So one could ask, why are they traveling all over the world to assist others when, their own country needs them?
I think it's their foreign policy. You know that since the United States of America imposed the embargo on Cuba, Cuba has been battling to make friends around the world, and they are using this opportunity to strengthen the relations with other countries. They will do it, even though in their own backyard there are challenges. And I think they believe that they'll be able to handle the situation back home, but also assisting other countries. You'd recall that the World Health Organization Director, Dr. Tedros, has made a call that countries must work together to ensure that we stop the spread of this virus. And I think that's exactly what's happening. We saw yesterday the conference where leaders were pledging to support the current projects that are in the pipeline, and in some countries they've already started to try and get the vaccine. It's a world problem. It needs all hands on deck, and I think with their foreign policy of assisting friends, they have decided to come to South Africa to do just that.
All right, SABC News foreign editor Sophie Mokoena, many thanks to you for that. So, of course, we are expecting the Cuban doctors to arrive then tomorrow, and I'm sure it is essential help that is much appreciated by South Africans.